Doc, how are you today? Good to see you.
Doing wonderful. With a week to go till Christmas, I'm doing just fine.
Is that a busy week for you, or does it slack off?
No, it is busy. It's busy. We're plowing the fields, as the old term goes right now.
Do people do the preemptive strikes and come in and say, hey, just go and give me a shot. I want to make sure that I don't get sick for Christmas?
Well, what they tend to do is they're on the verge of getting sick, and they'll come right in and say, I don't want to wait a week till next week to come in because we didn't know. I guess everybody thinks nobody works the week of Christmas and the week of New Year's, but, I work, so we'll be there anyway. But, everybody wants to, have that magical day 7 days from now and then, go to Hades in a basket the day afterwards. But, yeah, you've got that. You got kids home from school, getting refills and stuff while they're home for the holidays. Of course, they'll all freak out the week after Christmas and realize, oh, my goodness, I got to get my medications refilled. And, everybody, too, right now, it's really funny. Everybody's trying to get all this stuff done before January 1 because everybody's really freaked out about the Healthcare Affordability Act, changes in insurance, and how all that's going to affect everything. So, if you want something done, I tell you, between now and December 31st, darn good time to get it done because most folks in this business will to accommodate you. Most of my surgery friends aren't going anywhere till after the first of the year right now. I mean, they're busy working, doing orthopedic procedures and other stuff right now. So it's busy. I mean, that's one reason the holidays are stressful, besides you having folks that die, is there's just no let up right now. And there's a lot of work to be done.
As always, the doc gives us some medical insight in this first segment. Then we get to your calls in the second segment at 741-9450-800. 239-9569, and on Twitter as well. If you can't get to the phone and want to shoot a question to Doc, we'll gladly pass that on to him. As always, Lance, if you want to make him your primary care physician, it's quite easy to do.
It is a simple call, 822-0233. He's conveniently located in the Vestavia City Center. Beautiful new facility. Make sure you drop by. The 2013 medical guide is almost outdated, but still a lot of great information in there. You can pick up one absolutely free, 822-0233.
And that information will still be good early in 14, too. Just to remind everybody.
Absolutely. All right, Doc, you're going to talk to us about lung cancer today.
I'm really dedicating today's show to a very good friend of mine that's going through this. Just found out he had this, and some other friends of mine are going through it right now. We're going to talk about lung cancer. I know that seems like a Debbie Downer here during the holidays, but, a lot of folks are really worried about their health this time of year. You got these chronic coughs and I'm feeling well, or you'd be like me losing weight and people are wondering why you're losing weight and you start thinking, oh goodness, is there something wrong with me or something? But you go through this. But we're going to talk about lung cancer, and the reason why we talk about lung cancer is real simple. It is still the number one cancer killer in our country. Now, that being said, it is not the death knell that it used to be when one is diagnosed. We actually have a lot of exciting new treatment modalities and treatment drugs available now that are allowing us not only to diagnose people a lot quicker and a lot earlier, which is the key to getting cured from lung cancer, but we're also getting cures. Or we're keeping people disease-free that have the disease for longer periods of time without horrible side effects. So I just kind of wanted to go over some of the particulars. You're going to be around loved ones during the holidays, maybe something that you would want to go get checked out for and stuff during the holidays or after the holidays when you want to go get physicals and stuff where you start your physical programs. 9 out of 10 lung cancers currently are caused by folks that smoke. But don't be lulled into complacency if you're a non-smoker. Data is really pointing in the direction that those of us that have been around secondhand smoke, particularly as children, the risk of getting lung cancer later in life is dramatically increasing. Just anecdotally, the number of people I've seen that have lung cancer that never smoked has probably tripled.
So if you had parents that smoked indoors, smoked in the car, and you were around it a lot, it's something you need to be aware of.
People smoking at church, people smoking at meetings. And I still remember medical meetings. After my first AMA meeting I went to in Chicago in '84, man, there were ashtrays all over the rooms. Everybody smoked. Everybody smoked. Edward R. That Edward R. Murrow cool thing going on. But it went on all the time. What smoking does and what it does to help cause cancer, to kind of give people an idea of what it does, your lungs are lined with millions of these small hair cells called cilia, which are actively always sweeping particles and material out of the lung that shouldn't be there. What smoking does, it actually paralyzes the action of the little muscle fibers actually in each of these cilia so they don't move. And when that happens, all this particulate matter from smoking or in the environment hangs around the lungs, including carcinogens, and actually eventually gets taken in, damages the cells, and actually can cause the cells to be destroyed in the lungs and cause them to mutate and develop lung cancer from that. It's really a hard disease to diagnose because the first diagnosis is what? You got any ideas?
The first indicator?
Yeah.
I guess a cough you can't get rid of would be my guess.
Yeah, that's a good one.
I would go weight loss.
Weight loss. Well, let me tell you, by the time you find those symptoms, your mortality rate's almost 70% already. The first symptom of lung cancer is nothing. Most people develop lung cancers that sit in there for years, and unless you're doing a routine x-ray that you might pick it up on, you aren't going to see that. By the time you start to have symptoms, and you guys are absolutely right, weight loss.
And not to interrupt, but when you do a routine, like if I come in and I've got some congestion and I'll go back and I'll do an x-ray, will you pick it up on an x-ray like that?
Sure.
Okay.
That's still, even though they say it's not a diagnostic tool, I'll still tell you it's the best diagnostic tool in the world for finding lung cancer. But your first symptoms usually are that chronic cough, weight loss, shortness of breath, wheezing. And by the time somebody coughs up blood, like when you saw in Gran Torino, when he's coughing up blood, you usually have the cancer is metastatic at that point.
So months?
Yeah, it's usually months at that point when that kind of thing shows up. Now, the exciting thing we do have, if you have a family history, which there is indications that there are family histories of this, and you have risk factors, there are actually some screening procedures out there now, and particularly doing something known as a spiral CT of the chest or a PET scan is actually extremely good on picking these sort of things up or screening for early lung cancer activity, because it's like all the cancers. The earlier you catch it, the better your cure rates are. Now, lung cancers are basically broken down into two different types, what we call small cell or large cell. Small cell is one that's increasing in frequency, very smoking derived. It is, most part, those are very sensitive to radiation and to chemotherapy. The larger cell type cancers, your squamous cell cancers, and our number one cause of lung cancer, which is adenocarcinoma caused by scars on the lung, aren't extremely sensitive to chemo or radiation. Some of the new agents are better at treating lung cancer. Our dear friend Shane Corn, Shane from Centerpoint used to call the Feinbaum Show. I'm certain Jackie wouldn't mind me talking about Shane. But that was sort of what Shane had. It had a great response, but then all of a sudden the cancer just came back and jumped on him. It was terrible. Usually we won't diagnose it until we hear somebody having a cough or see something on an x-ray. Usually try to cough up some sputum or the junk down your lungs to try to do it. Get a CAT scan or the spiral CT scan. And then we have to go through, once you know it is a lung cancer, then you have to do what is called staging. That is, once you know what kind of cancer it is a small cell or a large cell, you've got to determine the extent and where it is. You've also got to determine about lung function. Is this person, if they're going to be a surgical candidate, can they, lung-wise, pulmonary-wise, tolerate having a part of the lung removed without making them a pulmonary cripple? So you want to do that, and there's several modalities that you want to do for that. Survival rates, though, have improved dramatically in the last couple of years. There's several, without getting into a lot of details about it. There are several new chemotherapy agents out there that we're using for that, as well as colon cancer, which have shown a lot of promise. And at least if we're not curing people, the disease-free period of their life that we're able to give them back, where they're not sick and they're healthy and they're doing okay, is dramatically increased. And as you saw with Clint Eastwood, that can be sort of liberating at times too if one wants to make changes in your life. But it's a terrible disease. Alabama's still at the top of the food chain. I think we're number 2 in the nation in cases of lung cancer here. There's a lot of things. And another big thing around here too, and for you new homeowners as the spring comes, as part of your home warranty, is to do a radon test. Now, radon are nuclear materials which come out of the ground, but our ground here is so porous, or particularly in North Alabama with the limestone content, you don't have the granite which protects that from coming up out of the soil. And this radon can actually, if you have the proper conditions around you, can set that off. Certain occupations, particularly folks that work with asbestos or work in asbestos removal, it's a big deal. Coal miners, though coal mining itself is not, just the coal dust causes a lot of problems, can lead to a different type of lung cancer known as a mesothelioma, which is another problem that we always have to look for. So we still have tons of it here. We talked about the e-cigarettes and all that. Well, people still smoke all the time. Kids smoke all the time, and if you want to give somebody a good present for Christmas, if they are smoking, let's help them get off the smokes and help them get a physical and get checked out. And the good thing is with most smoking, once you've been off the cigarettes 5 years, your risk of having lung cancer is no greater than anyone else out there in the population. But it's making certain you get them early, get that done early. But I can't stress enough about this one type called adenocarcinoma that the oncologists are seeing all the time. We're seeing it in the non-smokers, and it's caused from scars and damage in the lungs. Ozone from air pollution, obviously much better in our area, but if you're in the Far East or you're in a heavily industrialized area or even on the coast, look at those beautiful sunsets when you're heading out to Pasadena. The ozone will also cause a lot of lung damage too that over time, can lead to lung cancer. So those are all things that, now that I've fully depressed everyone, those are all things that you want to do, but I'm talking about this just for awareness and for my friend out there we've got 2 or 3 friends of mine actually fighting this battle right now. And I will end this particular topic on a very high note. The one great thing I can tell you right now about lung cancer is this. We don't see as much of it as we used to. I mean, you talk about where there's been a public health thing that has really made a difference. Getting people off smoking has made a huge difference. Where I used to see maybe a lung cancer every week or every month, I may see 1 or 2 a year now.
Wow.
And I'm telling you guys, that's some dramatic stuff, and I've seen that develop over the last decade. So at least on a positive note, we are making huge strides on prevention. I know it's a pain for people who do smoke, and I'm a fully believer in protecting your rights when you're out in public, but removing smoking from bars, removing smoking from restaurants, removing smoking from public places has made a huge public health difference. Getting rid of Joe Camel has made a huge difference. So as big a pain as those things are, we are saving lives, and it is making a big difference. So just to end it on a high note, guys, that's a good thing I can tell you just from personal experience when you see it.
That's the Doc On JOX. I don't even have to ask the doc why we use this music today from the great Charlie Brown Christmas special.
Amen. Last Doc On JOX for the year, so I had to bring something good for this year.
Hey, don't forget, with the grilling season still here, New York Butcher Shop, your place for all your game day grilling. From the best and prime certified aged Angus beef to premium pork ribs, chops, Boston butts, and all natural chicken. The New York Butcher Shop, your grill master's headquarters, located at the Heights Village Shopping Center, Cahaba Heights. New York Butcher Shop, 970-7300. We're getting right to the calls. First, we're going to do 2 things. The Doc's got the Scholar Athlete of the Week from AL.com and the Birmingham News, and we're going to make a show announcement involving the Doc on JOX. Doc, go ahead with our Scholar Athlete.
Well, it's a big announcement, so everybody better tune in. All right, our Scholar Athlete from the Birmingham News, Miss Mary Glenn Waldrop from Mountain Brook High School. 3.88 GPA, scored 32 on the ACT, member of the National Honor Society, Spanish Society, 3rd-year member of the Key Club. She's also been in the Mountain Brook High School Youth Legislation Delegation and attended the 2012 Leadership Birmingham Civil Rights Institute Team Summit. Now, one might think track and field, this young lady is a runner. Contrary, young men. She is the 2-time reigning 6A All-State javelin thrower.
Wow.
She won the javelin throw in 2012, 2013, outdoor, and let's see, she went 3rd indoor. She's also shot putter, placed 6th. I'm telling you, dude, guys, I would
This
admit,
girl's got it done.
She's getting an honor. Favorite subjects are anatomy, sports, medicine, biology, and the sciences. She's got a little bit of everything on her iPod. She's looking at the University of Alabama Honors College, Furman, and others. Baby, we want you at the University of Alabama. Y'all come on down to T-Town. But that is our Scholar Athlete of the Week, brought to us by the Birmingham News and AL.com.
If you've listened to our show, and congratulations to her, if you've listened to our show over the years, you know we've done many, and not as much as we should, we will admit, but many times we've worked with the Bell Center, one of the great charities here in Birmingham you've heard a lot about. And Lance, we've judged karaoke for them.
We have.
And a talent show.
We've done their tailgate challenge for the last 3 or 4 years.
One of my favorite events of the year, right before the football season starts.
And what we're about to announce, I actually did back in 2010 for them, so it'll be 4 years ago. And I guess once it's out there on 100,000 watts, we're kind of stuck into
That's
doing
right.
it.
We're about to make sure we get this done.
But,
whole show's involved.
Their biggest money maker, and they raise money all year. And look, it's early intervention program for kids with needs. My little guy was there for a couple of years. It's all about getting dollars in for these guys, and their biggest moneymaker every year is the Mercedes Marathon, which is a fantastic event. You've run in it before.
Yeah.
And we did it back in 2010. We're going to put together a relay team. We're not going to run the full marathon like the Doc can. We're going to bust it up.
Well, the Doc's going to run a full marathon the weekend before, but I'm coming back because this means enough for me to do this.
Okay, well, we appreciate it. The Doc, you, Dunaway, Rockstar, myself, we're going to put a 5-man team together. We're going to run the relay for the Bell Center. We're going to raise some money for the Bell Center, and we're looking forward to it.
Yeah, we'll tell you how you can help us raise money for the Bell Center, but that's the first time we've announced this with Dunaway out sick. All of us on the show and the Doc On JOX teaming up in the Mercedes Marathon for the relay to raise money for the Bell Center. So keep listening to find out how you can help us do that.
And 2 things we can guarantee. We will raise money.
Yep.
We will finish barring some kind of crazy setback.
And we're going to look really good doing it.
Okay.
And it will be the coldest day of the year.
It will be. Always is.
The coldest day of the year, man.
Can't wait. All right, so there you go. We're official now. We're in the Mercedes Marathon, the Jocks Roundtable and the Doc on JOX. All right, let's get to some of these questions for the Doc. We'll start with Ronnie in Tuscaloosa. You're on with the Doc on JOX, Ronnie.
Hey, I have a 17-year-old son who tore an ACL in his left leg 3 years ago.
Okay.
And got it repaired. Everything good with that one. He is practicing soccer the other day and planted that left leg and went to kick with his right, and when he kicked, he tore the ACL in his right knee.
Yes.
Now, he is a high grade point average kid. He has a 3.98 with a 32 HET. Some Division II schools went to him in baseball and soccer.
Yes.
So he's quite an athlete as well. When his baseball coach asked him, would we consider bracing that right knee without doing surgery till baseball season's over with, in the summer.
Yes.
And just wondering, the repercussions of doing that. I mean, he's walking around now.
Yes.
Without crutches, but he's not. He says it's real loose. It feels loose. He could fall any time, almost.
Yes.
But just your thoughts on it.
My thoughts real simple. Brace it. I mean, if this guy's looking at Division II schools and Division II schools are looking at him, do it. This is such a common problem in this 16 to 17 to 18-year-old category. Their joints are still real loose. Their tissues are loose, but they're putting on all this muscle mass and everything. It's a very common injury. I mean, you think about it, I think Mark Ingram. Mark had to have both fixed like that. Trent has had both fixed. Actually, it's kind of funny. A lot of running backs in college football have these things fixed. Usually during a red shirt year, they can burn or to get better. I'd brace it during baseball season. They've obviously got tape and film on this guy. You're going to get him fixed right after the season's over with, hopefully. The surgeons are sort of trying to wait around, see if his ligaments and tendons and all don't tighten up and toughen up a little bit more in the interim. So that's not as big an issue for him and maybe be able to get by with physical therapy alone. But he's going to put on a lot of muscle mass and bulk in the next year or so. And really going into the spring, I would imagine he'll do a lot of that. And that extra mass is going to put extra torque on that knee. And when you're up at the plate or you're out in the field or you're behind the plate, the last thing you want to do is mess it up. So unless he's trying to be a pinch runner, I'd say use the brace and go out there and get after it.
All right, Ronnie. Thank you.
I mean, do you fix it first?
I think if the surgeon thought it should be fixed first, they'd probably go ahead and do it. I think it's probably not bad enough at this point that they want to do it. Remember, people forget about our buddy from Pelham, Lane Bearden, punted with a torn ACL for 3/4 of a season and did darn well. So they're probably it's all about timing right now. So that if the surgeon's not wanting to go ahead and fix it right now, wanting to wait, I'd sit tight. The worst it's going to do is give, and then you fix it in the spring and be done with it.
Okay.
Thank you, Ronnie. Let's go to Hayden and talk with Brent. He's next with the Doc on JOX. What's up, Brent?
Hey, guys. Thanks for taking my call.
Sure.
I really enjoy it. Dr. Ricketts, I had a question. I'm recently recovering from a lumbar laminectomy.
Yes, sir.
10 days out, and the surgeon was Dr. Jeff Wade, did a fantastic job.
Excellent. He's a great guy.
Yeah, had a lot of nerve involvement in my left leg, a lot of numbness, and a lot of pain, and that's totally resolved. I mean,
okay.
Couldn't be happier with that. I just had some questions about the recovery time, and started physical therapy this week, and excited about that. But what, in your opinion, what's the general recovery time? When could I expect to go back to work and be 100%?
Ooh, okay. Well, work's probably going to be at least 2 to 3 months, depending on what you do. If you're sedentary, you're obviously going to get back sooner. If you do hard physical labor or even work as a delivery guy like all our friends at FedEx and UPS and everything right now, in the Postal Service. It's probably going to be a little longer because it's going to put a little more strain on your back and all that. And you're probably looking at a 6-month total recovery period before you can just totally be unleashed to do anything. But Jeff's going to guide you through all that, and he's going to tell you exactly when and what you can do and where. But that's sort of what I'd expect right now.
Okay, yeah. Right now, just kind of fighting through the soreness and doing a lot of walking, that kind of thing.
That's good. Keep those muscles built up. Keep that weight under control. That's really, really huge, both prior to surgery if you can, but certainly after surgery.
All right, Brett. Thank you.
Thanks. Appreciate it.
All right, man. Let's go to Athens and talk to Chris. Chris, you're with the Doc on JOX.
Hello.
Hey, Chris.
Hey, thanks for taking my call.
Sure.
Here over the last couple months with my right arm, I've been having some problems. It first started off at the shoulder area right above the armpit, and now over the last month and a half, I've experienced my last 3 fingers feeling numb, and over the last few days now it's gotten worse to where my whole hand feels numb, and it feels like it's a whole lot weaker than my left hand, and I get jolts of pain, especially while I'm asleep, running through the finger right beside my pinky.
Sure.
And also in the mornings, it seems like it's a whole lot worse where if I turn my neck, barely to the left or to the right, then I get a sharp pain in my upper middle spine area. So kind of just wondering what you think that might be.
Well, my guess is it's probably going to be actually, believe it or not, coming out of your neck because of the positioning and the time of the day it's happening. It's also involving those nerves and a very specific distribution that you want to see. You want to look at the shoulder and the neck both. Nothing says that you can't have 2 different problems going on at the same time right there. I'd go see my doc, get my neck definitely looked at, look at the shoulder too. Let's get some therapy going, get non-steroidal going, get some things to get you through the holidays until we can get some imaging studies done, see exactly what's going on, and get you a long-term fix on this thing, bud.
Okay. Do you think it could be like a pinched nerve, or?
Well, pinched nerves kind of is the generic term I'd used for it. And I would expect that possibly from a slip disc in your neck is what I'm thinking.
Okay, I was just wondering because it kind of scares me that I'm losing strength in that right hand.
Well, that's the reason. I want you to go. Well, that's the reason I want you to go and see the doc, because when you are starting to lose strength, then that is a major problem.
Okay.
All right. Thank you, Chris.
Thank you.
A couple quick questions on Twitter before you go, Doc. Number 1, Tampa Tide fan says, how often should males age 20 to 40 get a blood panel done?
Ooh, it varies. Probably basic cholesterol every 2 to 3 years, and basic electrolytes probably about the same thing every 2 to 3 years.
Is that just basic blood work?
Just basic stuff, yeah.
And Brad wants me to ask you about the connection between welders and cancer. Is it high lung cancer?
There is a lot. Actually, it's a great question.
Okay.
And there is with the soldering agents and those sorts of things that the guys have to use. There's a lot of intake with that, even with wearing the mask. And it is a bit, they're working, tough industrial environments. They're using all kinds of different rebar and stuff that they're soldering with and everything and all that stuff. There's a definite connection there.
All right. That's the Doc on JOX. If you want to make him your primary care physician, call this number.
Yeah, make that call 822-0233. Real simple, 822-0233.
And Doc online always.
You bet. Listen, you may miss me here for the next 2 weeks. We'll be back first Wednesday in January, but you can always get us at markrickettsmd.com. Follow us on Facebook and Twitter. We'll be working all during the holidays. If you're in our area, come by and see our facility upgrade and pick up a good medical guide. We'd love to hand one out.
Doc, have a very Merry Christmas.
And a Happy New Year to you, sir. And hopefully happy tax deduction before we
get,
we get back together. And I guess, Lance, I'll see you after we come back to Pasadena. You guys need to be training, okay? Training.
Yes, sir.
Training. 3 miles, 3 days a week. You got to do it.